What if I told you that fear doesn't just live in your mind, but can actually change what happens inside your body? What if chronic fear, meaning constant stress, anxiety, and worry, can create conditions that allow tumors to grow faster? And what if the opposite is also true? That deliberately placing your body into a relaxed state could support better treatment outcomes. This video is not about blaming patients. It's about understanding biology and reclaiming one powerful lever we all have, our nervous system. Hi, my name is Crystal. I'm an 8-year cancer survivor who leveraged meditation and visualization to overcome a rare and difficult to treat bone cancer. As a mindset coach, I teach cancer patients how to use their minds as a powerful assist in the road to recovery. It's important to note that I don't recommend anyone forego treatment, and nothing here is meant to replace medical care. Rather, I'm here to tell you that your mind, your emotions, your nervous system can and will affect how well your body responds to treatment. Now let's talk about fear. Fear is not just an emotion, it's a biological state. When your brain perceives danger, real or imagined, it activates the sympathetic nervous system, often called fight or flight. This causes increased cortisol and adrenaline, elevated inflammation, suppressed immune surveillance, and reduced cellular repair. In the short term, this response can save your life. But when fear becomes chronic, meaning days, months, or years, it creates an internal environment that's hostile to healing. Your body is no longer focused on repair, it's focused on survival. Here's where things get especially interesting. Research has shown that chronic stress hormones like cortisol and norepinephrine can increase inflammation, can promote angiogenesis, which is the creation of new blood vessels that tumors can use. It can reduce natural killer cell activity, which helps detect and destroy abnormal cells. In simple terms, fear doesn't necessarily cause cancer, but it may remove the brakes that normally slow abnormal growth. It's like constantly pressing the gas pedal while cutting the brake lines. So if you're like me, when you received your diagnosis that you have cancer, your body likely went into a state of fear. That means if you've remained in a state of fear, that most likely you've got elevated levels of cortisol and norepinephrine, which means you're increasing your inflammation, creating new blood cells for the tumor, and reducing your natural killer cells, which help and detect and destroy cancer. And it's totally normal to have this response after your diagnosis and to remain in a state of fear. Cancer is a very scary, very real threat. My fear response got worse and worse after my diagnosis as the tumor continued to grow despite going through treatment that was supposed to shrink the tumor. I also had a lot of fear about the tumor spreading. And guess what? The tumor started infiltrating my bone marrow. Then another spot was found on my cervical spine. It was becoming pretty clear that my body was not responding to treatment. So what did I do? I started meditating and put my body into a calm, relaxed state. And that's when my fear and anxiety dropped significantly. And then everything started turning around. Within 3 months of daily meditation, my radiation treatment started working and the tumor started shrinking. I continued meditating every day, and the tumor continued to shrink until I was classified as no evidence of disease 2 years later. Basically, your body operates in two major modes: fight or flight, or rest and repair. When fear dominates, the body diverts energy away from immune function. But when we activate the parasympathetic nervous system, something we can do through meditation, the body shifts gears. Your heart rate slows, inflammation decreases, immune signaling improves, cellular repair increases. This is the state where healing becomes biologically possible. Studies in psychoneuroimmunology show that relaxation practices such as meditation can reduce stress hormones. It can also improve immune markers. It also enhances the quality of life during treatment and improves treatment tolerance. Again, this is not about thinking your way out of illness. It's about changing the internal terrain in which healing occurs. This message is often misunderstood, so let's be very clear. No one chooses illness, but once fear shows up, and it always does, we can choose how long it stays in the driver's seat. And learning to regulate your nervous system may be one of the most underutilized tools for the cancer patient. If you take one thing from this video, let it be this: healing doesn't happen in panic, it happens in safety. Creating moments of safety for your body, moments of calm, may help your body do what it already knows how to do. And you don't have to just do meditation. You can try visualizing, guided imagery, hypnotherapy, acupuncture, anything that gives your body a relaxation response. However, there is something very beautiful and simple about meditation. Meditation is free and easy to access. If this video helped you understand the mind body connection in a new way, please consider liking and sharing it. Subscribe and let me know in the comments what you'd like me to cover next.